Hi everyone, my name is Caitlin Henner and this is my literature review presentation. Starting off, my research question is going to examine the relationship between age and infant-directed speech preference. So those are my two variables. As we know in the Many Babies dataset, we include age bins from about 3 to 12 months. For my hypothesis, I am going to expect that age is going to have a moderate positive correlation with infant-directed speech preference. The article that I'm going to be unpacking today is looking at the preference for infant-directed speech in the first month after birth. So, within this research, two experiments were conducted. The first one looking at preference for IDS over ADS in 1-month-old infants. The second experiment doing the exact same thing, but for newborns up to 4 days old. For both experiments, researchers hypothesized that significant results would indicate that infants would in fact prefer IDS over ADS. In this experiment, the way that researchers measured preference for infant-directed speech or adult-directed speech was via looking time. There was a checkerboard placed on the wall in front of the infant, and either infant-directed speech would be played or adult-directed speech would be played whenever the infant started to focus on the checkerboard. One advantage of this method is that it was unbiased visually because the same visual stimulus was used for both IDS and ADS. However, one limitation of this method is that an observer manually started and stopped the looking time timer when they thought it was fit that the infant was either paying attention or not. So there might have been a little bit of error with this. After a 2x2 ANOVA was used to analyze the data, results did confirm the hypothesis of this study. So it was found that infants did have a significant preference for infant-directed speech over adult-directed speech, both for the 1 month and the newborns. And for the 1-month-olds, there was an effect size of 7.29, which is a medium to large effect size. And for the newborns, the effect size was 8.31, which is a very large effect size. So what do these results mean? Well, first and foremost, they are going to support research done previously that demonstrated that infants older than 1 month prefer IDS over ADS. It's also going to fill in that unknown gap, whereas before there was no research done on young infants like newborns and 1-month-olds for their preference on IDS over ADS. But perhaps most importantly, the implications of this study are that parents can in fact influence the attention that their babies have based on the type of speech that they direct towards their infants. And secondly, it confirms that newborns can recognize the similarities between the speech that they hear before they are born and the speech that they hear now when they are fresh in the world. This study is going to support my hypothesis because other findings in the study revealed that 1-month-olds actually had a longer looking time towards infant-directed speech than those newborns did. Although these results weren't significant in this study, it still is one step towards confirming my hypothesis. So my study is really going to build off of this one by not only obviously examining those infants in the same age bracket as the ones in this study, but also expanding and looking at a little bit older infants as well and seeing if the same pattern continues.